This video will review different scenarios and diseases a CNA may see on the job. It will also have several questions that you may see on the state written exam. Let's take a look at our first scenario. Mr. Padula is shaking and convulsing. What is wrong? What should the CNA do? He is having a seizure. What should the CNA do? Number 1, do not leave the person alone. 2, lower the person to the floor. 3, note the time when it starts and stops. Remove eyeglasses and anything around the neck. Place something soft under the head. Move objects away from the person. And after the seizure, turn the head to the side. Also make sure the mouth is clear of food, fluids, and saliva. This is what to do when a resident is having a seizure. Our next resident is Mr. Ali. Mr. Ali is complaining of pain and numbness in his back, neck, jaw, and stomach. What is happening? What should the CNA do? Mr. Ali may be having a heart attack, a myocardial infarction. Call the nurse at once. Mrs. Jones is eating lunch. She starts to cough. What should you do? Mrs. Jones may be choking. The first thing to do is to stop the feeding. Ask her, "Are you okay?" Encourage her to cough. Encourage her to cough forcefully. Offer water and report to the nurse. This is what you will do in your skills exam and also what you would do on the job. If a patient starts to cough, stop feeding. Are you okay? Encourage her to cough forcefully, offer water, and report to the nurse. This is Mr. Zarate. Something is happening to Mr. Zarate. His face is drooping, and he is slurring his speech. What is wrong with Mr. Zarate? What should the CNA do? Mr. Zarate is having a stroke. Might also be called a CVA or cerebral vascular accident. The CNA should call for help immediately. Our next resident is Miss Smith. Miss Smith is diabetic. Her body cannot produce or use enough insulin, so sugar builds up in the blood. When working with a diabetic resident, what should you report and what should you know? Here are a few important things to remember. Blood glucose is monitored. It may be monitored daily, or it may be monitored 3 or 4 times a day, depending on the resident. Good foot care is needed. The resident may not feel injuries on the feet. Always check the care plan before providing any nail care. This may not be the job of the CNA, depending on the resident. Check the dietary card before entering the room. And remember, consistency in what is eaten and when is very important. The CNA needs to report if a resident misses a meal. The CNA needs to report any foot problems or wounds. The CNA needs to report any signs of hypoglycemia or hyperglycemia. These are important things to know when working with a diabetic resident. All right, let's see who else CNA Maria is going to work with today. That may be all of them. We'll do a quick review. Seizure, myocardial infarction or heart attack. Here we have choking, stroke, and diabetic. Okay. When our CNA goes into this room, she sees that there is a fire. What are the 4 steps to remember if there is a fire? We use the acronym RACE, R-A-C-E. R, rescue persons in immediate danger. That is the first thing to do. A, sound the nearest fire alarm. C, confine or contain, close doors and windows, turn off oxygen in the general area of the fire, and E, extinguish and exit. Here we have Mr. Tan. Mr. Tan requires mechanical ventilation. What is your role as a CNA? Let's take a look here. The CNA needs to reposition the person at least every 2 hours. The CNA needs to leave the call light within reach, complete a safety check before leaving. The CNA should provide frequent oral care, at least every 2 to 4 hours. Things the CNA does not do. These are outside the scope of practice. The CNA does not suction the airway. The CNA does not adjust the oxygen flow. And the CNA does not turn the oxygen on or off. Things that the CNA must remember are to recognize signs of hypoxia and report to the nurse. The earliest signs might be restlessness, dizziness, and disorientation. If alarm sounds, make sure the tubes are connected, reconnect, and report to the nurse. Okay, let's go to our questions here. Oh, we have one more. All right, here we have Miss Ali. Miss Ali's doctor has ordered her to be on bed rest. What does this put her at risk for? And what is your role? Here we can see that she is at risk for many things. She is at risk for blood clots. She is at risk for pressure ulcers. The CNA should report at once any skin discoloration. And it might be white, red, pink, or purple. All of those need to be reported to the nurse at once. She should be repositioned at least every 2 hours. The CNA should encourage coughing and deep breathing exercises as part of the care plan. And she may be at risk for orthostatic hypotension, abnormally low blood pressure when the person suddenly stands up. Your role is to follow the care plan and report changes. Okay, a resident is choking. What will you do? This is a question that will probably be on the state exam. The first thing to ask is, can the resident cough or talk? If the resident can can cough or talk, you need to encourage the resident to cough. If the resident cannot cough or talk, then the best choice, the first thing to do would be abdominal thrust or Heimlich maneuver. And always report to the nurse. All right, let's do some practice questions for the CNA state written exam. If a CNA finds that a diabetic patient blank, he or she must inform the nurse as soon as possible. A, fails to eat anything at lunchtime. B, insists on combing his hair at odd times. C, reports feeling numb in the feet at times. Or D, refuses to finish writing a will he or she has started. The correct answer is A, fails to eat anything at lunchtime. A resident with type 2 diabetes asks a CNA to cut her toenails. Which actions listed below should the CNA take? A, make a point of checking the patient's blood sugar level before trimming the nails. B, give the resident a safety clipper to use. C, read the patient's chart to see what the doctor has ordered with regard to trimming of nails. Or D, report the nail trimming request to the nurse. Correct answer is C. Read the patient's chart to see what the doctor has ordered with regard to trimming of nails. Next question, a CNA encounters a small fire in a patient's room. The room is empty. What is her first priority? A, rescue patients in the neighboring rooms. B, activate the fire alarm. C, close all doors. Or D, grab a fire extinguisher and attempt to extinguish the fire. The correct answer is B, activate the fire alarm. The key here is the room is empty. The room is empty. There are no patients to remove. So you go to the second step, activate the fire alarm. If a CNA notices a patient appears to be having difficulty swallowing, what should she do? A, notify the nurse immediately. B, mash up the food and continue feeding the patient. C, give the patient smaller amounts of food with each bite. Or D, nothing. The doctor checked the patient's swallowing already. Correct answer is notify the nurse immediately. Okay, a patient should be given CPR when A, there is no breathing or pulse detected in the patient. B, the patient is unconscious. C, the patient appears to be choking. Or D, the patient is not breathing, though a pulse can be felt. Correct answer is A. There is no breathing or pulse detected in the patient. Okay, our next question. A CNA is in the dining hall with residents, helping them eat. All of a sudden, one of the residents stands up and starts to clutch his throat as he releases a silent cough. What action should the CNA take first? A, immediately call 911. B, immediately start the Heimlich maneuver. C, ask the resident if he is choking, or D, immediately begin to administer CPR. The correct answer is C. Ask the resident if he is choking. A resident is choking. The first response by the nurse aide should be to A, go find the charge nurse. B, get the suction machine. C, call emergency services, 911. Or D, begin abdominal thrusts. The correct answer is D, begin abdominal thrusts. With these questions, you need to look at your choices. Of these 4 choices, what is the first response? The first response of these 4 would be begin abdominal thrusts. If we look at the last question, the first action the CNA should take, first you can ask the resident if he is choking. Next would be the Heimlich maneuver. So these questions, you just need to look at what your choices are. What is the best choice of the 4 that you are given? Here we do not have the option to ask the resident if they are choking, so we begin abdominal thrust. Okay, a nurse aide enters a room to help the resident to the bathroom. A trash can is on fire and a trash can in the room is on fire. What should the nurse aide do first? A, use the resident's pitcher of water to put out the fire. B, open the window to get the smoke out of the room. C, yell fire along with the room number. Or D, remove the resident from the room. The correct answer is D, remove the resident from the room. Okay, how can a CNA help prevent the development of pressure sores? A, turning the patient every 4 hours. B, providing a full bed bath 3 times a day. C, doing partial baths every time a patient soils herself. Or D, reducing the amount of fluids the patient drinks to minimize incontinence. The correct answer is C, doing partial baths every time a patient soils herself. A CNA enters a patient's room and finds the trash can has a fire burning inside it. What action should the CNA take? A, call the nurse to come help. B, reach for the facility's fire alarm. C, remove the patient from the room. Or D, put out the fire. Correct answer is C, remove the patient from the room. Since patients with osteoarthritis can be put on bed rest for long durations, CNAs should be aware, A, of the need to reduce stimulation while providing passive motion. B, of the need to turn the patient at intervals of 2 hours while encouraging coughing and deep breathing. C, of the need to keep the client lying still and provide sufficient massage. Or D, of the need to encourage the patient to cough and take deep breaths while also limiting the intake of fluids. The correct answer is B,